to you from LA Shoulder Studios in Calabasas, California. You didn't expect that one, did you?
No, I didn't at all.
That's the actual intro. That's what it's going to be like. So here we are in the first actual episode. I've been saying that like every time, but it's all been a pilot. This is actual first episode on the LA Shoulder podcast. With us today is Lukas Foster, orthopedic surgery resident in Los Angeles, and Ryan Finkel, and both of which are MDs, actual medical doctors. He's also orthopedic surgery resident at Cedar Sinai in Los Angeles. And say hi to the group.
Hey guys, how's it going? I'm Ryan.
Lukas over here. Happy to be here.
It's awesome.
So anyways, yeah, that's the formal start to the show. Other than that, how you guys doing?
Doing great. Thanks for having us. Thanks for the tequila.
So what did you expect? What did you expect this to be like?
Honestly, great question. I mean, when you guys invited me here, I was going back to all the podcasts I've watched, and I was like, I'm not entirely sure what to expect today. But, after hearing, remembering that Lukas, had surgery from you and all that stuff, I was looking forward to hearing the behind the scenes of that.
Yeah, I wanted to know more too, because I forgot how long it's been. It's been like how many years? Like
it was right at the start of residency, so it's been like 5 years.
Surgeon?
Yeah.
Right when I became a surgeon. That's when you trusted me.
I think I was your first case.
You might have been my first pec tear that I did on my own.
Yeah. Well,
how are you doing?
It's holding up. So you did something right.
Well, so tell me what that was like. So how did you injure your shoulder? It was your left side?
Yeah, left side.
And it was what was the injury? It was a pec tear, correct?
It was a pec tear, yeah. It was like the classic. It was during COVID, so all the gyms were closed, and so it was like the classic like pre-injury tendonitis, like was doing nothing but push-ups. And then I remember the days leading up to the injury, I was just kind of like, man, my pec feels really tight, like something feels off a little bit, like it just felt like tendonitis. And then I was being a knucklehead, and then it was actually a wrestling injury with an old friend where they came down over the top of me, and then I just like eccentrically contracted my pec as my shoulder flexed, and then just felt a pop.
While you're wrestling?
Yeah.
It was during training?
No, it wasn't training. It was literally just like being knuckleheads, just like having fun. But I felt a pop, and then I didn't like bruise. It wasn't like the classic Google image where your whole arm is like purple and all that. So I didn't think that anything of it. It just like really hurt to sleep on. But then once gyms finally opened back up, and I was just like doing dumbbell flies and chest press, I was just like, something is horribly wrong. Like couldn't do more than like 20 pounds without just feeling like bowstringing across my axilla. And that's when I knew something was wrong.
So you felt something happen when you're wrestling. That was probably like the injury.
Yeah,
right?
Definitely. It was like a small pop, but I was just like, oh, maybe it's just like a partial tear, or maybe just like a muscular tear. And there was like a pinpoint bruise, very small, at the pec insertion, which I was just kind of nervous about.
What part of your arm? Like here?
Just right
on your bicep?
Right here, yeah. And so I was like, but I was like,
you're tough.
When you think of pec tears, you think of just massive bruising.
I didn't tear my pec.
Yeah, your pec completely sagging. I was like,
what didn't even cross your mind, right?
No, I was just like, I'll be fine. And then,
did you think you injured yourself? Did you think
I thought there was a partial injury, but I didn't think it was an operative injury. I thought it would just go away with time, and the pain did subside over time. It was just like, I can't sleep on that side; it'll go away. But it was when gyms opened back up that I knew something was wrong. And then actually it was like an early trauma case where they were having me cut the X-Fix bolts with like the breaking and entering.
Those big.
And I was like, I can't even do this.
Bolt cutters, right?
Yeah, exactly. And I was just like,
you have to get your arms way out. And
yeah,
I used to put one on my leg and then just push down.
Those are hard when you don't have a pec tear.
Yeah. I mean, it was impossible.
You have to have like a wingspan of like an eagle.
Yeah. I mean, I ended up like holding it like this, like chicken arming it, and then bringing it. And then the trauma surgeon was just like, dude, that was the most unathletic thing I've ever seen in my life. And I was like, I have an injury.
You're going to injure yourself. So and don't further injure yourself. So you toughed it out. You were still working as an orthopedic resident, right? This is what year residency?
Intern year. So
this was your intern year, right when you started.
Yeah. The injury was, so we start residency. We started residency, Ryan and I did, July 2020. Mm-hmm. And then the injury was April 2020. So I was still in like end of medical school, and so it's like this weird lapse
I
of medical
remember you
insurance.
came to me and you were like, "Hey, I had this injury," and it had happened like earlier.
Yeah,
Right.
and I was just starting residency, so I'm like, I'm not gonna. Hey, thanks for taking me. I'm out.
I
'cause
remember
need surgery.
Paymont came to me and he said, "Michael, I think you need to,
Yeah.
do what needs to be done and basically like fix this if it needs to be fixed." But he basically, Paymont, the program director, came to me with like, we got this new intern. Do you think this needs surgery? And I could have said no. I could have said, it's like, well, it needed to be fixed and it was an acute injury. So injuries, like you see me in a sling, right? It's just like time goes on, but injuries happen and you need to be like aware of them and then do something about it.
Yeah. I mean, this wasn't even on
with
your
guys, we tend to neglect these things,
Yeah.
right? It's like, and especially starting orthopedic surgery residency, you don't want to be that guy.
Well, this wasn't even on your radar. I didn't talk to anybody about it until December.
Yeah, right.
So-
you waited. And
So
you
the
were just
injury is
struggling.
already 8 months old.
Yeah.
I
was
golfed
just
with you
so
like
it's
3
chronic.
times before that.
Yeah. So I
So
was
you
like,
toughed it out.
yeah, I was like, this will be fine. I'm not going to be that guy at the start of residency. I didn't know what recovery would look like. I saw,
So you were working out after so once you injured it and then you started working out, you knew something was wrong.
yeah,
And you like, my lifts are not the same. How long was that from when you injured it? How long was that time frame?
it was when gyms started to open back up in COVID. So maybe this was like 2 to 3 months after the injury. And it was like going from, I by no means was working with a lot of weight beforehand, but it was going from like 90-pound dumbbells to like literally 20. And it was like, it felt like there was maybe one last little strand of tendon hanging on because it just felt like really weird bowstringing across my
And it got
armpit.
worse? Did it get worse? Did it feel like the tear was like
No,
getting worse?
it didn't. It just felt like this is what your arm is like. I couldn't even do a
It
push-up.
was settling.
Yeah, I couldn't even do a push-up. So I was like, all right, this is just what my life is. And then it was the X-Fix thing where I was like, I'm way too young to like not be able to do a push-up or like do my job. And that's when I went and saw somebody
In
else.
your 20s, right?
Yeah. And then now 30, but yeah, at the time, 25, 26. And so then I went and saw somebody else first and they were like, oh, chronic injury, talking about Achilles allograft. I was like, oh my God, that's terrifying.
Yeah, I got the papers on them right here. We can look at them.
Yeah, I was like, that terrified me. Like cadaver tendon going into my body. Like we can go over it or whatever, but obviously knee-jerk reaction was like, thinking about infection risk, thinking about all this stuff. Like I made it a much bigger deal than it had to be because of me delaying it. And then that's when I went to Paymont to get his thoughts on it. Because I had talked to some senior residents. They were like, maybe non-op it. And the first guy I went to go see also was like, maybe non-op it. And then that was when I talked to Paymont, and then Paymont called you. And then, rest is history.
Right. So the graft, what we're talking about, it looks kind of like this. These are some of the pictures. This is an Achilles graft right there. So you can see this is a donor graft, and then they have to sew that into that small tendon stump. That's the Achilles right there. So obviously it's not your own Achilles, but you can utilize these kind of grafts. In these chronic cases, these types of things sometimes are necessary. You have to do these bigger incisions. And in your case, did I use a graft in your case?
No, you were like, I'm going to do everything I can to repair it primarily.
Yeah.
But you were like, because of, I anticipate this being scarred, very scarred down, like the typical like cosmetic axilla vertical incision. You're like, I'm not going to do that. I have to do a full delto pec.
This guy right here is great. So Steve Mora, he's the guy who did the mountain, and he fixed his pec tear. The mountain.
Oh, yeah, yeah.
So this guy's over in Orange County. He's a friend of mine. His daughter's actually a Smith and Nephew rep. She works over in the Valley. But he fixed this guy's shoulder, and this guy's lifting like 1,000 pounds. He lifts. How much does this guy bench? It's incredible how much he benches. But
more than me.
But this guy, Steve Mora, he was a county trained guy. He's over at Restore Orthopaedics, I think, over in Orange County. But he does UFC fighters. Really great sports guy, friend of mine. But he has this graft technique. So you go on here. He has my pec fix. So you can see all this bruising. You can see that.
Yeah.
So
my arm did not look like that.
He also does all these like pictures where he draws in the graft. like the pictures of it, and it kind of helps make sense of what he's doing. And so in the case like this, he's doing a full reconstruction now with grafts. So like in your case, that could have been an issue just based on how long it took for you to get surgery. You know, you want to fix these ideally within 6 weeks.
Yeah, and that was my own doing and own fault. But I got lucky.
You got lucky. And I think in some cases, there's even cases where, you know, I'm sure that a lot of people will be interested in, you know, who have had pec tears, who haven't had them fixed. And the data on that really shows that, let's get rid of this guy. He's great though. The data really on that really shows that if you have a revision and you need either chronic or you have a revision like you've had failed primary surgery, like it failed and retore, either way the results are better if you fix it, but you fix it right with graft. Because guys like Steve Mora, and there's some reported papers in the literature, and I'll post them to the channel so you can see those papers and you can access them there. But basically, if you're using an allograft and you do it the right way, the outcomes are much better. So in your case, you healed, right? So as long as it heals from the tendon down to the bone, then your muscles can get strong again. But if the muscle is detached from the bone, the tendon sometimes is not fixable anymore. So those big grafts, those Achilles grafts, as long as they heal somewhat to whatever's left of that tendon stump, or get some kind of type 3 converted to type 2, or converted to type 1 collagen, type 3 to type 1 collagen in some form, you're going to have better strength just by having that attachment there. But you're not going to be lifting like, you know, the mountain is lifting. But the outcomes are still better. And there's people I know that are surgeons. A plastic surgeon in LA, who's a friend of mine, has a chronic pec tear, and he just still hasn't gotten it fixed. And he does push-ups like this, you know, because we're good at adapting. You know, we just basically adapt to the problem. And that's what you were doing for a while, and you just see what you can do. But certain things, those muscles are there for a reason. So if that big muscle in your chest is not there, the other muscles will adapt, but it's going to strain them more. And you're going to be at risk of certain types of injuries, especially if you're doing like combat fighting. Yeah. You know, that kind of stuff. So how you fix it does matter. Like your surgical method, like the surgeon is the method. You know, a lot of the times that's why some really great surgeons can fix bad problems that have been, you know, tried again. And when they fail, sometimes the biology is the problem, or there's a nerve issue. But if it's a mechanical issue, as orthopedic surgeons, we're usually pretty good at fixing those. You know, so with these are external tendons, they're not within the joint, so they tend to heal more reliably. You know, so somebody young and healthy, your tissue should have healed, right? So we didn't talk about anchors. You can get more detail about anchors. We have some studies on that too. I don't know how nerdy you want to get today or how interested you are, but you know, using cortical troughs, there's a different paper that basically shows different biomechanical strengths if you drill holes in the bone, or if you put an actual metal button in the bone, or if you use suture anchors, which are kind of like screws, and those have sutures that kind of pull the tissue back down towards the bone to reattach it. And as you know, we use those all the time in orthopedic surgery. And
I think that's what you used for mine.
I use anchors, yeah. I just use suture anchors. Yeah. So you can see in this diagram right here, where it really starts tearing from is the S7, which is down below. So it's actually one of the more inferior fibers, which is the sternal head. So why you didn't feel like, hey, maybe this is a partial injury, why you didn't feel like it was a full injury, potentially is because the clavicular head is still attached. But those larger multiple pennated fibers from S7 typically up to S5, sometimes it tears the whole thing through, but it always starts at S7, and it's right during the bench press. There's another video I was going to show.
And I think that the MRI chest reflected that too. It said like basically a wisp of the clavicular head was still attached.
It was still attached, right?
Yeah.
But this is something where like PRP is not going to make a difference. So there were some other studies that show PRP does make a difference if you fix it. It's going to have lower recurrence rates. But where PRP, platelet-rich plasma, will not fix it, is it's not going to reattach the tendon. That still needs surgery, right? So we were talking about with the different options in suture anchors or buttons, those all show that if you drill a trough in the bone and you bury it in the bone, and then you put sutures through that, it's going to fail less often or at a greater strength, greater failure load than the buttons or the anchors like I put in yours. So then you would say, well, obviously, why wouldn't you just pick that for all these tears? Because that basically those failure loads are scientific values, right? You know that. It's like, it's going to show that the optimal load might be something, but in reality, once that tissue heals, it's load sharing. So it's not all based on what that failure load is. And drilling big troughs in your bone, that risks fracture, you know, and that's really technique dependent. So just because it works in the lab doesn't always mean it's the best thing, you know, for your shoulder. But that's still why, you know, I selected anchors that I was comfortable with. I had done that procedure before in training, and I think I had done a case or two actually in practice. So by the time I got to your case, I was pretty comfortable with it. And you just have to understand the anatomy. So like in this video right here, this is Rafi Mirzayan from over at Kaiser. He's also a really great sports surgeon and shoulder specialist, elbow specialist. But you can see here he's outlining the pectoralis and showing the anatomy and the biceps where that comes in. Basically how big those fibers are, but how short and small that tendon is. And so if it tears from the tendon and the muscle, we know that those are those basically like type 2 tears where the repair is going to have allograft because you're going to need to sew something in. So Rafi uses a lot of dermal allograft. I don't know if you guys use this in spine at all.
Not a whole lot of dermal allograft, but there aren't many instances where you're doing any sort of like tendinous work.
You don't use that a lot in spine? In sports, we use it a lot. You know, dermal graft is basically skin tissue that has been harvested and processed, and they take all the cells out and they leave the collagen behind. And so it can be a good use of collagen structure. So for something like this, you know, Rafi is a big fan of using allograft, use it for a lot of tissue procedures because there's little downside. You're adding collagen, you're sewing it in. I think if you can make structural mechanical stability and load share across all those little muscle fibers, that's really where you can help prevent those re-tears. Because re-tears definitely happen with these pec tears. Did you have any aspect of re-tearing in your shoulder?
No, there was one night.
Like any partial tears or muscle, like looking like the muscle kind of retore it all? Did that happen?
I don't think so. There was one night where I was reducing an ankle where it like spasmed a little bit, and I freaked out and thought that I retore, but there was no bruising or anything. It was fine.
That must have been terrifying.
Yeah, it was. I was like, great. But it was fine.
When did you know you were like out of the woods? Like, okay, I can do whatever. I can lift as much weight as I feel comfortable. Like, do you feel like that now? Like you're fully recovered?
Yeah, 100%.
So at some point from then until now, you felt like I can do whatever I need.
I mean, honestly, I felt like I made gains in my recovery up to like 1 to 2 years after. But
so 2 years basically.
Yeah, where I continued to improve, but to the point where I was like, okay, I'm happy in the gym. I'm like lifting good weight. It was probably 6 to 8 month range. Because I remember you had told me like slow it down a little bit.
Early slow it, right?
Early slow, yeah. Because I was texting, I was like, feels great, feels awesome.
That's right when you're at risk for re-rupture.
Yeah,
right?
I was like, I'm back. I feel awesome. You were like, take it easy. So I was really trying to go slow with it. So
you can see here, this is nice how Rafi shows. So see all these sutures he's really sewing in there, and then you can really load share with this graft. Look at that. I mean, he pulls on this big muscle in the cadaver, which sometimes you just like tear right through. So this is something I've been thinking more and more about is really is optimizing mechanical strength, which with each case. It's not just like getting through the case. It's like, how do we optimize the outcome, right? So it's about, my term now is quality over quantity, right? So it's all about having quality outcomes, because when you're there, you're talking with the surgeon and you guys have a plan, you need to trust or just know like he has your best interest in mind, which I always do for my patients, and that it's really the best surgical plan, to get them the optimal results that they're looking for. Sometimes to get that requires, a lot of times you can get through the case, and a lot of times the outcomes are fine. Those little differences in the bell curve of the complications and problems, right? Those can be minimized. We know that poor outcomes can be minimized through sterile technique, through, standard kind of operating procedure and going through things like in a similar way, systematically, a good knowledge of anatomy. Like all these things minimize complications, seeing patients at relevant follow-ups, getting appropriate imaging so you can do something about it, right? These are like ways we can use our doctoring to minimize like the bad outcomes. So like when I was starting practice, it was just about like getting through everything safely, and it was kind of about getting all my checks done and my credentialing and all of that. And that whole process takes a year, because you're still in like boards collections. And so and you're still trying to do safe surgery and develop your reputation. But, you're also like trying things out, and sometimes things go well, sometimes things get fucked up. The 2 rules of surgery are, surgery's hard. And the second rule is sometimes shit gets fucked up. Sometimes things don't always go as planned, and, you have to know how to fix them.
Mm-hmm.
So those are things you just learn through repetition.
Yeah.
And so after that first year, you really get through like, okay, now let's really try to streamline things, all your paperwork and getting everything, like everybody on the same page so that everybody knows your system. And then that takes like a couple more years, right? And so then all that whole time you're doing safe surgery, you're getting better, you're trying to improve your outcomes. And then you finally get to the point where you're just like, surgeries just go well now, just like pretty much all of them go well. And if they're not going well because of all of these like pillars I've developed, like the whole system is now so strong that there should be some explanation for the problem, if there is a problem, because otherwise things are just expected to go well, which is great. That's what everybody wants. They want a well-working machine.
Yeah, it's nice when going through all these rotations and seeing like the streamlined aspect of a lot of the more senior surgeons that have been there for a while, and you're like, oh man, like from A to Z, like from clinic to the OR back to clinic, it's very streamlined. There's not a lot of hiccups, and I feel like that's the ultimate goal.
Well, and then that's what you see. And then you get to the point where then you achieve that goal. And then you're like, okay, well, then what else? And then you start looking at those details about how your outcomes are actually looking, and you become more critical of your good outcomes that you thought were good. Or, sometimes your problems start coming back and you're like, oh, okay, maybe that can be adjusted to make those complications less. Or, that person was smoking the whole time, and I got to ask more people about smoking, And so like you just become better at like seeing those things, so that as long as you have that mentality of trying to avoid complications, trying to have the best outcomes for your patients, then like that mentality continues to push you to improve. But it has to be based on that mentality. So what I've been doing, and I'm kind of more in the phase now of like being more critical of like his shoulder, right? Like those people that you don't want to talk to or see again, right? And now it's just like, hey, I really want to know, did you have any tearing in the muscle? Maybe there was something that I could have done better, for the next person. And when you tear your pec, that I'll now know, like I'll use graft because I can look at Rafi's technique and I haven't seen any problems with it. So like we can make those little differences to make the surgery better. That's where like, if you just look at doing things faster all the time, or like how many cases I'm getting done, that's not your focus. So like if you have that as your focus, those little things do continue to improve, because otherwise you just don't see them. We're not looking at the same thing. We're all just saying everything's fine, right?
Yeah.
Everything's fine. Everything's cool. Everything's fine. You have to be critical.
For sure. I think as residents, I know I'm guilty of this. It's just like you feel like you see the attendings operate and you're like, wow, that's so good and it's so fast. And so you jump too quickly on the fast part, and if you just try and go through things fast, you're going to miss minute details and maybe not do the best job. So like one of the trauma surgeons, he always says like he said, bad and fast never becomes good and fast, but good and slow always becomes good and fast. It's just a matter of repetition. So I've always like
stay good.
I've always just like kept that in my head of just like, be methodical, details matter, don't rush, like have a plan. The last place you ever want to rush is an operating room.
Yeah. Well, you guys are great. I mean, both of you are really great. And I think it's because you have great mentality. It was great working with you guys, because you just remind me, it sounds crazy, but myself, and it's like, well, you don't necessarily need somebody that reminds you of yourself, but the way you guys learn, because there's good learners and there's good teachers. And I think if you have a good teacher, you can teach bad learners and you can kind of make them pretty good. And if you have a good learner, they can figure things out from a bad teacher. Like we all know there's not great teachers, but if you put those two together, it can be really great, because then everything just kind of can, like, hey, you're going to learn great. I'm going to teach you everything you want to know and you need to know, because I want to make you a competent surgeon. But like doing that is a lengthy process.
Yeah, I can imagine.
It's a lengthy process.
Yeah, it's cool getting more comfortable around, the operating room and feeling like you have the skills to do, a lot of stuff in the real world. Pretty soon we're graduating in a couple months here.
You guys are
almost done. Yeah.
Wow.
Yeah, which is nuts.
More time for podcasts then.
Yeah. Feels like just yesterday we just started, and you blink and it's over, and you kind of have the moments to digest a lot of what you learned when you're kind of in the operating room with a little more leash, and you're like, oh man, I actually, I do know how to do this. I can do it comfortably and safely, and you're never looking at the clock, and that's pretty cliched, but this place definitely helped us out a lot. And the teachers, like you for instance, you learn a lot in your operating room, even though I'm not going into shoulder.
Just skills, a lot of the skills,
just like being comfortable, like standing, like where you need to stand, like how things need to be, just so you're ergonomically okay and can react in like an athletic and swift way. It's pretty underrated, I think, honestly.
What do you think about, like, so what was have you had surgery during residency?
No surgery.
He's one of the few residents who haven't been operated on in residency.
You had a weird like
nerve injury.
I had a weird weird.
Is
like,
that fully explained?
No one knows what
Nobody goes
happened there.
fully through the resident program without having some kind of problem.
Yeah, thank God that's better. That was
something from a textbook.
It was a scary
It's like Werdnig Hoffman or some kind of testicular torsion.
No, what was it? It was like some brachial plexus, like
parsonage turner.
Yeah,
I think it was real parsonage.
I think
turner.
it was too. I mean, thank God it was. I mean,
we thought it was a neck disc herniation.
Yeah,
right?
I got MRI, neck, got
and then you were doing
workup.
that. You were doing that stupid TENS unit wrong, and so it was like activating your shoulder this weird way. And I was like, why can't I lift my arm? I'm like, well, he's like, hey, let me take my TENS unit off. And I was like, okay, now do this, and then you could lift your arm.
Yeah, I was
It
literally.
was like your
walking around.
muscles were like contracting in a way that.
I was walking around with a TENS unit on probably 12 hours a day, and Stone was like, "Oh, here's some good PT to do. You have to just do this." I'm like, "I don't know why. I literally can't move my arm right now." And
He's like, "I think it's paralyzed."
I'm like, "Oh no, it's just contracting the wrong way." You take this off, and like, "Oh, this actually."
All the pads are immediately over my brachial plexus.
Yeah, no, thank God. Honestly, I feel like all of us need to have some scary injury happen to us, and obviously get like better from them to have an appreciation for what we do. Because now
did you take time off?
No, I mean didn't really need to. Luckily I was like kind of on a slower part of work, but I had a Medrol dose pack and essentially back to normal within like a month. But
no endorsement by Pfizer or Medrol.
Oh yeah, we're not affiliated.
We're not affiliated in any way, nor do we endorse their products, orally or systemically. But did you take time off?
No, I just moved my schedule around. So one of our rotations intern year is night float, where you're just basically covering the gen surge floor pager.
You're just running around.
Which doesn't, so I had my sling on, but I was just answering floor pages, and then
you weren't lifting things.
No.
When did you start lifting things? When did you start working again, where you're like, I can go back and do surgery?
Like a month later.
A month?
Yeah. But I was like taking it easy, T-Rex arms, everything right here.
Yeah, other people were doing most of it.
Yeah. I mean, as an intern, I was just suturing, so everything could just stay right here. But like lifting, like doing reduction, like I didn't really have to test it until May, and I had surgery in January, so it was 4 months post-op, and I had no problems.
When did you go back to like snowboard? Do you snowboard, right? You're from Idaho.
No, I'm from
just
here.
I just picture you from being from
I know,
Idaho.
yeah. I do too, trust me.
The Holy Grace land.
Yeah, exactly. I just got back yesterday. But
you snowboard or snow ski?
Snowboard, but very like not good at all. Just like going down the like blue squares or
You're
whatever.
You're pretty
with
good, man. I mean, we have a residency ski trip every year, actually coming up next weekend, and from what I remember, you're pretty solid.
I can get down the mountain. That's it.
That's the goal.
And it hurts a lot.
The goal is just getting down the mountain. Anything else is just extra.
But I'm nothing special whatsoever.
Who's gonna get injured this year? Isaacson almost died one year.
None of us, man. We're just bringing our kids up there, and we're just gonna have some whiskey and play with our kids.
Yeah. You're not gonna ski?
No.
Is anybody gonna ski?
Yeah, a lot of people are gonna ski.
Oh.
But I mean, we're just so close to the end that like if you injure yourself, and fellowship is 1 year, it's like you can take it easy for a year just to make sure you don't hinder your education.
Yeah. Completely agree. Also, it's like $250 for a day pass these days. Did you know that? Nuts.
You'll stop caring about that very soon.
Well, in order to stop caring about that,
successful podcast, then
true. In order to stop caring about that, we have to graduate and then finish fellowship and then be good.
We have to not tear both of our ACLs on the mountain.
That's the thing. It's like I train jiu-jitsu, and it's like I can't train right now. It's like I gotta let it heal. But also when I go back, I am just trying not to get injured because I injured this. Doing jiu-jitsu, I'll have a whole section on Mike's shoulder and why he should avoid surgery, any further surgery. It's like one of those things where it's like you got to do what you want to do, and sometimes there's risks involved with that. Lifting weights, you might injure yourself, but if you know more about it, and you do it the right way, you're less likely to injure yourself lifting weights. And then you have all these benefits of better health, more muscle, better body movement, better coordination, less likely to get, you're a trauma surgeon, hip fractures, right? As you get older, the more muscle mass you have, get up and go time. Those are the things that we need to like stay cognizant of as like we're telling our grandma when they come over, hey, like, what should I be doing? Like, they always want to know what I should be doing. And literally the most important thing is just getting up.
Yeah, weight bearing
and, like,
exercises.
Moving.
Yeah,
like,
it's so underrated.
It saves your life.
Literally.
Because then you get hungry and then you want to eat and then you have better nutrition, and then better nutrition then makes you want to go work out. Even grandma can go work out and take creatine. You know, it's like, ladies take creatine, guys take creatine. It's safe.
I just started getting back on that. Yeah, I just started getting back on it.
Especially if you're trying to grow muscle. You're drinking alcohol, you're not taking creatine, and you're not eating protein, but you're working out. Does that sound like that's going to work? It's not going to work at all. It's like you have to hack the biology, you know, to a certain extent. Like, and I learned that when I started training. I just overdid it and I injured myself because when you're young, you go so hard. You know, like you injure yourself wrestling. It's like, that's silly. You're not going to do that again. No. You're an old man now.
Yeah, exactly. Exactly.
You just use your brain better.
Right.
But you
totally.
learn.
The ego.
These are young people injuries.
The ego goes out the door.
The ego causes injuries.
Like, I refuse to arm wrestle now. I'm like, I've seen way too many, you know, Holstein Lewis spiral distal third, like humeral shaft fractures from just arm wrestling. You know, I'm like, I'm not doing that. For what? For your ego?
Yeah, good. There's good ways you can have high injury avoidance with just small avoidance. Like, just never arm wrestle, and then you'll have a much lower rate of arm fractures.
Yeah, rupturing your biceps.
Yeah, rupturing biceps.
Yep.
Oh, speaking of ruptured biceps, that guy, your friend Aaron, called me today. Aaron Pierre, you know that dude?
I talked to him briefly.
Yeah. We're friends now.
Yeah. Oh, really?
Yeah, we're homies.
Yeah, that was a random thing how that all set up. I was about to scrub into a case.
Crazy. He called me today. He's doing so great. Yep. He's gonna be doing he's gonna be the Green Lantern.
Oh, wow.
Whoa.
Yeah. He's like doing big stuff. And he's a really cool guy. And he's just like, I'm keeping him on track. He injured his arm and he's back to basically full training now. You know, he's about 4 months. But he's got to shoot all these roles. So it was kind of like, hey, what can I do to do these roles? And thanks for sending that guy, by the way, because I was a great person for him to communicate with at that level too, because I do jiu-jitsu. He injured it, kickboxing. He wants to come out and train out here too, you know? So it would be great to have somebody who you can kind of keep an eye on in a certain extent with people that you trust. Like, he wants to train with people that, like, how do you find people that you trust when you train jiu-jitsu or kickboxing? He literally ruptured his arm doing it. You know, so doing jiu-jitsu, you're wrestling around with these guys. You might hurt yourself, obviously, but if you, like, he's a purple belt. So he actually, like, he trains jiu-jitsu and kickboxing, and he's looking for guidance on, like, who can tell you how to get back to that? An injured shoulder surgeon who does jiu-jitsu.
Yeah, honestly, your marketability went up so much more.
Seriously.
Ever since you hurt yourself. You could just use
You're like,
yourself.
I know exactly what you guys are going through. I went through it twice.
It's helping me talk to all my patients because
Yeah.
it's just like, I let me tell you what works and like what doesn't work. Basically everything I've been telling them, if they just listen to it, is pretty much the right thing because that's what I've been doing.
Yeah, I think the most surprising thing with this,
It's like, no pain, just don't move it. Just keep it the right place. Sometimes it hurts, but nutrition, that's where like the XR stuff, you know, I've been taking the XR nutrition, essential amino acids, creatine. That's where I've been getting much more, like, I've been reading more about it now because I talked to Paymani, laughed at me, you know, about the nutrition stuff. And it's laughable because it's like, well, you think nutrition is going to fix your shoulder? It's like, look, you retore your shoulder. It's like, well, yeah, it wasn't that, right? It was the other stuff. But if you do, what I think the nutrition has a role in is pain management, because if your body's hurting, it's telling you this needs something. You need to ice it, get rid of the inflammation. You need to take your essential amino acids because that's building blocks. You know, and that area is like screaming for extra stuff. You got to take your zinc, vitamin C, vitamin D. It's like, I sound like these people on, you know, all these health podcasts now, but it's like, it's literally true because the XR, which is not a sponsor on the podcast, but you know, I used it myself for my own surgeries and I'm using it again for my second surgery. And it's just totally like a game changer for how little pain you have. Like if you use the ice machine, I use the Game Ready ice machine, I use the XR, and I just take one of those shakes. And if it's starting to hurt a little bit, I ice it and then I take one of those shakes and like the pain goes away. and you keep taking the pain medicine that your doctor prescribes, and all of it is supposed to help.
Yeah.
And it's either zero pain or it's just manageable.
Mm-hmm.
But a lot of it's mental.
Yeah.
What was your pain like after surgery?
It was fine. I mean, I had an interscaling block pre-op, so
Yeah, and the blocks help too.
Yeah, I never had to take any narcotics. I took the oral Toradol to completion.
Toradol is the best.
And
if you can take that, if your kidneys are good,
Yeah.
Toradol is the best for pain.
Yeah.
Right after surgery.
No, it was virtually non-existent. It was just a little sore. The weirdest thing was the interscaling block because all your proprioception goes out the door too. So I remember just getting down in the car and being like, what is this weird thing swinging in front of my face? I was like, oh, it's my arm.
How long did you use a sling for? Like 2 weeks?
Yeah, you told me.
I said
you
6
said
weeks, right?
No, I think you said 2 weeks, and I think I used it for a week, just because I was like, "This is I can
You were
leave
just
my
careful.
arm by the side."
As long as you
Yeah.
leave it by the side.
Yeah, I wore it at work for 2 weeks just to like give people a heads up, but I mean at home I never wore it.
Did anybody give you a hard time at work?
No, not at all. I mean, I didn't have to miss any time. I was just like, "Hey, can I move this around or whatever?" And they're like, "Yeah, no problem."
Yeah,
no problem.
I think the way that you did it with your schedule was clutch because you were able to essentially have 4 weeks of, being a night owl and not having to do anything pretty manually, physically intensive.
Yeah.
And that's like when most of the healing occurred.
Yeah, it was super lucky.
I can edit that out.
Money.
Do you think it still looks okay? Do you think Paymont's going to watch this or listen to it?
I don't think so unless we explicitly tell him about it. If we tell him that we're on it, though, he will.
I love him.
He would watch it for me.
He'd watch it for Lucas and me.
Yeah,
and
he
you.
would. I mean, literally, he calls my son his grandchild, which I agree with.
He bought my kid, Wes, a nice little sweatshirt from Montreal. I wish I had one.
Yeah. He has this nice place in the desert. My son, we celebrated my son's first birthday there. Let the whole family come in from Idaho. Let us all stay there. Like, the guy's literally family.
Yep. Hope he's having a good time in Argentina right now. I'm sure he is.
I'm sure he is.
Banffy was just there.
Yeah, just like doing a crazy hike, right? I think he gave us a grand rounds.
Yeah.
Like a week after he was, 20 million feet in the air in Argentina.
He was there for like a week.
I think so.
That guy works like crazy, and then he goes on these crazy trips.
Yeah, he's a high functioning dude.
You want some mandala?
I gotta finish this first.
All right, you want some?
I gotta finish this first.
Oh, okay. Sorry, guys. I ran out of the classe. Sorry, I thought those were full.
No worries.
Banffy would be great. I want to talk to him, and then he can scold me.
Yeah, that'd be awesome. I mean, no better guy to talk to about sports-related injuries.
Mark Davidson. You know Mark, the Arthrex rep?
Oh, yeah. Yeah, he's a great golfer.
He's a great golfer. He's a very interesting guy, super smart, very, very handsome, very nice. He'd be good. But Brian Coleman, I want to have him on. But, I think having people that will reliably show up, like, hey, can you guys actually make it out on a Sunday and take a few hours?
Yeah, totally.
To shoot the shit and drink some mandala.
Yeah, keep the mandala coming. People will show.
Yeah, just have it ready. Have it ready to go. Well, this is the first episode, so it's going to be released on YouTube. We're going to have it out probably in the next couple weeks because I'm going to put about three to 5 episodes together.
Mm-hmm.
I'm going to have some more people over. We'll shoot some more episodes, and then I'll kind of release it all together. But these will just be for the early subscribers.
Nice.
So if you guys are, please subscribe. I think you just subscribe.
It's on YouTube, right?
Yeah, it's on YouTube.
All
So just
right.
go Michael Stone MD. I'll send you the link and stuff, and then that way you guys can subscribe to the channel. This just died too.
Yeah, I'm realizing that I feel like having content out there, in like the surgical world is pretty important. Ways to differentiate yourself and I don't know, especially for the young people.
Well, I just like doing it. I mean, I think if you can do something, I got the idea. I didn't want to do a podcast because everybody was doing a podcast. And so it was like, well, I don't want to do a podcast because everybody else is doing it. And it's like, well, if you think that way, that doesn't make sense because then why are you doing your podcast? So then I started thinking I had a reason to kind of put a lot of my ideas together. And first of all, having something to talk about that could help people. I was really talking to my patients over and over again about the same things. So it was okay, what does a pec tear look like? What is a conversation like with that patient? What am I recommending? I'm recommending surgery. So it's it's really a lot of the same stuff. It feels repetitive, and some of the things that I'm interested in are not necessarily that type of repetitive management. So as long as people get the information the right way, because it's pretty much like just getting the right information, people just don't know. Okay, so you have this injury. What does that look like? Like this guy had that story. You had a pec tear. You had surgery on it. I did your surgery and everything went well. You know, you had a good outcome. What did that timeline look like? So that's going to be across the board in somebody who's young, healthy, who didn't have problems. And that's just what it looks like optimally. I was trying to optimize my recovery and pushing it too hard, you know, and that's what that looks like. So sometimes those things happen, but either way, those are interesting things that people can learn from. So I found myself like going in a certain like direction where I could like utilize like my knowledge of talking to people with those problems, and then other people can learn from that in like pretty much like an interview format. And then like, oh, grandma has that problem, like a rotator cuff tear, you know, there's like so many problems that you'll see or hear, and that will be like something that's like relevant, you know, like traumatic injuries, or even just like wear and tear problems, like rotator cuff tears. You didn't even know you had it until you went in to see somebody, you know, so like that can be helpful too. But that's where I got the idea. Yeah. And so I was like, well, if I can like do that, I've always like wanted to talk to interesting people. Like I have a lot of interesting people from like my fellowship that were like, Jerry Williams is awesome and he's had shoulder problems, but like I've listened to these other shows where people are just like interviewing them about like their like academy membership. It's like, who wants to listen to that? Like I really love those guys and I don't necessarily care about those things, but like I want to know who that guy is, you know. And like if you talk about an injury, it really shows. Like I delve into people's lives every day, you know, it's like through their problem. And so I like get to know them through their problem. So that's kind of like what the show is about, is like getting to know people like through that problem, how it affected them, like how it affected your work, and like where are you now and how it's affected your life. Your life's great and now you're on my show. So that's where it can go. Yeah.
This is the top of the mountain right here.
This is the top right here. This is the pinnacle of success.
Yeah, I think how you were talking about like getting your clinic and like you know your practice dialed, resources like this, you know, patient handouts, QR codes or something. Just
I did that for what QR codes.
Just to, you know, like you're saying,
stuff out.
The mundanity of describing the same thing over and over again. It could be just a good sticking point to patients because they're nervous probably in your clinic and you're telling them they need surgery and they're like, oh my God, like putting yourself in their shoes for a minute and then, you know, having a digestible piece of content where they can
take some time, look it up,
go home, sit on the couch.
Oh, hey, that guy has a show on that problem, and then you can like listen to it. Like, how long is this? Like an hour, you know? Maybe it's like listen to that part. And like with YouTube now, I think a lot of these programs you can like scrub through it and just find the relevant parts.
Yeah, I think it's gonna be like the next big thing.
Yeah, it's just like, and it's getting people good information, but who gives you the information is like so important. You know, it's right now, it's the people who are up there on the microphone don't necessarily have the credentials to like tell you the right thing, or you can't necessarily trust it because it's this like manufactured thing from some giant company. But this is 100% independent. So like this is just for entertainment purposes, folks, you know. But it's like we're going through things and kind of going through like my process for figuring things out based on like my training and my credentials, and maybe like that knowledge will help people just to like understand that's probably similar to the problem they're having, or maybe it's like something that they've had before that they now need to get checked out, but they can like listen to the show or like not, you know, and just like kind of pull out parts that are helpful for them. But hopefully it's like something that is like listenable and like watchable, and that's like consistent, because I'm going to put it out ideally each week, like every 2 weeks really, for this show. And then I have my other Stone Family podcast. So we're doing like that other show too. So that'll be like for all the other cool stuff that I do, like jiu-jitsu and motorcycles once I can ride again. So I'm gonna have to do this one for a while because I can't do cool stuff for a while.
Modifiable risk factors.
Yeah, but I was thinking like every 2 weeks, but it's just like something that comes out every month. You have a couple shows.
I mean, yeah, I think you're onto something.
But getting you guys out here, and I think people need to come out. I'm gonna have a studio in LA, so that way people will just come to LA for the show.
It's 30 minutes to get out here, and it's nice out here.
You don't mind?
I mean,
well, it's here for now. This is going to be the hub for now.
Solid spot
with the falling curtains.
Yeah.
So you guys have plans with your wives later? That's why we got to cut it out, or can we hang out for another hour? You guys good? We'll play Mortal Kombat.
Yeah, sounds good. Sitting right there.
Yeah, that's why I got all the cool stuff here, so we can hang and play.
Yeah, it is nice here.
Or you can just like hang out. We can play with Hooli.
I'm down.
Go for a walk.
Sounds great. All right, I'm going to get back to life.
All right, well, you guys want to call it?
Sure. I mean, yeah.
Is there anything else you want to talk about, or any other handles you wanted to bring up? Instagram, YouTube stuff. Were you guys going to be going for your fellowship that maybe don't want to talk about that? Anything else you want to
Not really.
bring out on the
Yeah,
podcast plan? These are all my notes.
I'm not cool enough yet to advertise myself.
You never
in
gave
the
me your
future.
consent form, though.
Oh, I know. I'll give that to you.
Yeah, well, just so it's on, it's
File.
been documented. You
So
did
you can
consent.
use my name and likeness for the rest of my life.
Here, this is what I wanted to show.
And incision.
Let me show this one. All right. I'm going to show this video of this guy tearing his pec. This is what yours looked like.
Yeah. I was benching this exact amount of weight as well.
Watch. So this is right side.
10 pounds.
Right there. Oh my God. So it's basically that eccentric. See that right there?
It's always on the way down.
On the way down. Right. Coming up.
Dude,
Big
that's
one.
so
I gotta say, man,
horrible.
That was a rough
seeing these
one.
horrible injuries
That was
day in
full
and day out at
focus.
work, these videos still get me. I can't watch them.
But it's like the same one. It's like I was looking online and it was like so many videos took that guy's video and then they talk about it. It's like they like take other people's content and then make it new content. It's just like you can look at other people's videos and make your own
And
stuff.
dub them over.
Yeah, it's like meta videos.
It's all the reaction videos.
Yeah, right.
Like
You're,
people just
watching
post YouTubes of them reacting to stuff.
pretty much.
Yeah.
But my kids are getting into it like automatically. They know how to just like that's why we have a Stone Family podcast. It's like with them. So it's like we take videos on those little meta glasses that I have, those Ray-Ban metas. I showed you those, right?
Yeah, they're sick.
They're so sick because I can take these little video clips and they're like, hey, let's go ride motorcycles. So I got in these little electric dirt bikes. We'll go out to the hills and then I can just get a little video clip of them. Mikey, my oldest, he's 9. He's doing iMovie editing now. So he'll take that clip, I'll like text it to him on his iPad, and then he makes a little movie out of it. And then we'll put it on his little YouTube channel. And then we talk about it on our podcast. And we like pull his little clip up, you know? So it's like I get them doing stuff because he's like totally into it.
Yeah.
And he gets on the show and he's like talking about stuff. He's like, well, Dad, what about this? It's been like a good way for us to just like talk to each other.
Oh, yeah.
It's super
Future
cool.
That's awesome.
cinematographer.
It's amazing.
Yeah.
That's really cool.
Yeah.
That's
He's got to
awesome.
like train him. And like my other son does not, he's like, I want to make movies, but then he's just like, I'm going to go play baseball, you know?
Yeah.
But like Mikey's like, he finds these little projects. So if I give him these little kind of like something to work with, you know, he like a Lego set, that's where it started, is like Legos. He's like, oh yeah, Legos are cool. So then he'll just like lock into that. So the same thing was like, oh, show you iMovie, show you like how to do clips, how to use an iPad a little bit. So he's just like making these little movies with his little jets, and he'll like put the camera up, and so it looks like it's flying. He has this movie that's called America Fights Back. He's like, Dad, it has that title. He's like, it's against Russia. I'm like, let's be
Wow.
cautious. Let's tread lightly here.
You have a very, your
politically
child is
aware,
very
right?
in tune with current events.
He has his finger on the pulse.
Yeah. Yeah, for sure. Reads the morning paper.
Yeah, he's up to date, I guess.
Yeah.
But he also loves jets and motorcycles. But it's pretty much every time I have him come on, they just want to talk about video games, motorcycles, and that's it.
I mean,
Baseball.
Sounds great.
What more could you need,
Well, yeah.
honestly?
Every time.
I'll tune
Sounds
in.
nice.
I was interviewing these kids. That's how I started. Cass had her little cousin over, and I was like, "Hey, do you want to be on my podcast?" And he was like, "No." You know, he was like 10, and then he was like looking at the stuff, and I was like, "Yeah, try the headphones. You can hear it." And he puts it on, and so he sits there, and we start talking. I'm like, "Do you mind if I record?" He's like, "Yeah, it's fine." So we start recording, and then next thing I know, we're like having this like awesome interview. He's like telling me about like Twitch, like on the video games, how
Yeah.
he got his friends get paid money for that.
All these pro athletes have their Twitch streams on
Right?
the side.
They're
like,
playing video games and they're recording
getting
it.
paid big time.
Whoa.
I mean, there's a market for it.
Exclusive
I
avenue.
guess.
Do you know
Yeah.
about this?
No.
You're an old guy.
Not
You
that
call
old.
your
You
back.
will.
Old soul. I don't know anything about this.
He's up to date.
Yeah.
He knows.
Yeah,
Ryan's in the know.
I try to keep up.
Ryan
He
knows.
Yeah.
Ryan's camera's off though. Sorry, Ryan.
It's all good. No
Camera's
one needs
dead.
to. No
The
one needs to
voice
see
in the
it.
sky.
This is Lucas.
Who knows everything.
It is the Lukas Foster show.
This is Batman's episode.
This is your episode. I was just the lucky guy who got my pec fixed.
So who else did you consult before you decided on me? Did you like, or were you just like too inexperienced to know you should probably get a second opinion?
I mean, they
Just
were
trust me.
at Cedars, but it was just the allograft thing.
You should ask if your doctor is in board collections or if he's board certified. Make sure your doctor is board certified, folks.
Yeah. I think just the biggest thing that made me look for a second opinion was I mean, when I
You didn't need a second opinion.
was when I talked to
You got my
Paymont.
second opinion from me.
Yeah,
I gave you
exactly.
both.
Exactly. I like that you said you're going to try and primarily repair it. That's what I liked.
Yeah, it's really trust. Like when I talked to Banffy about my shoulder, it was just like, this guy knows he knows he can fix it. You know, and I was just like, clearly I know he can fix it.
Yeah.
And he's going to do a good job because it seems like he cares. Like he should do a good job.
Did you get a repeat MRI on this one?
Yeah.
And is it obvious on the repeat MRI? Because
No, it could go either way. But I was looking at it, and I was like, I think it's retorn.
did they have to do like any sort of different sequence?
They
Because it's
didn't.
sort of-
But the weird thing was, because my biceps tore, it wasn't repaired in the first place. Because I told him, don't do a tenodesis. I told him not to, and I was like, well, do it if you need to. And it was kind of partially torn, so he just debrided it and then put a graft on top of the whole repair, so it looked awesome and solid. And then because I think I stretched things out, the biceps tore, then everything kind of tore from there. And then that left this big hole in the MRI right where my biceps was, because my biceps was like down half my arm.
Oh,
And so
man.
up here it looked like this giant hole, maybe in my cuff. So we were looking at it together like, it could go either way, because post-surgical changes, you could still see it was coming down, but it's thin. It's like, if it's thin, it's probably retorn. So I was like, it's probably retorn.
Was there an instance, was it on that day that you guys were in the operating room together where you're like, I definitely re-injured this, or were you just like, I'm just not progressing?
Yeah, I mean, going back too soon, doing cases that were just a little, like big cases. And
But was it like
sometimes-
a pop? Like, oh man, I just retore, or was it like, I'm just super
maybe
sore?
one day when I was lifting weights where I felt like kind of a strain, I was like, oh, that's weird. And it was like, all it takes is like from this to that, you know, it's just like, and it changes the line of pull, you know, and then it's like, it's kind of screwed from there. So if it pulls off like that, even if it's a tear in continuity, that's where the cuff, can like still be attached. And on the MRI, it looks intact, but that's why Sugaya, when you look at how thin it is, that is more likely to have a re-tear if it's thinner. If it's a big, thick tendon on the MRI, that's why, like, if you put a graft, you make it, you just don't stretch it or do too much. It should heal ideally with a big, thick, bulked tendon. I think you should use those too when you're doing your trauma cases. I think you should really consider, more grafting. And that's why I want you to learn on the sports service as you're going to go into traumatology, because you're going to be aware of the bones, but the soft tissues, especially like rotator cuff, like tendon attachments, you're going to be doing like tendon repairs. I've seen people where they just, they don't think certain parts are important to repair. Like the pectoralis, I've seen a lot of damage to the pectoralis just after surgery. That's something where you might go in, and if there's a case where you're going in for a revision, have allograft. I've had cases where people are going in multiple times for like fractures, and you might want to have like either some Achilles around, but really the one is just dermal graft. Just have dermal graft. You can sew it in over stuff. I had this lady who had this huge deltoid defect, and I put in this huge dermal graft over the front because her deltoid was just gone. And I told her it's not going to get stronger, but it will cover your coracoid more. And stuff like that really helps people. She was like in tears when she came back, because she was like, it's like the defect is gone. So if you can use graft for certain reasons, I would just have it kind of like, have like the Arthrex guys or whoever your graft people are, have them kind of like on standby for your cases. Usually most hospital systems, they have kind of stuff available. But I would just consider that too. Sometimes graft can really like help you, especially if you're using it just to kind of reinforce things, instead of just saying like, the muscle's all totally damaged.
So you're
Just
saying
take some
like
time and
your
graft it.
big deltopec to anterolateral incisions, like just to back the pec up or help the pec out? Because I feel like in a lot of those approaches, you end up taking down a little bit of the pec to get the exposure.
For deltopec?
Like say you have like some big comminuted proximal humeral shaft fracture. Like this is a case that I'm
when you're
thinking
going
of.
these big ones.
Yeah,
in
like
the
a
front.
deltopec to an
Yeah, you usually
anterolateral
take some
approach,
deltoid
and you
down.
end up taking down, a little bit of deltoid, but also sometimes even
Definitely
a little
some pec. Yeah.
So you're saying like those cases?
I think so.
Yeah.
I think so. Especially any revision, I always have graft available. Bone graft too, but for rotator cuffs too. Just like those greater tuberosities that you'll fix open and do a little double row, or even if you put a plate, if you put a graft on there because the tissue's poor, just so you like have a good kind of grasp of that tendon. It's pretty much just collagen, and it's human collagen. So I don't think there's a downside to that. The Regeniten graft, which is bovine, I think that's like less structural, and so it becomes a little bit of collagen, so it kind of has to heal, but you're not sewing things through it. So
good to know.
Yeah. But little tips of the trade. All right. Well, on the next episode of the LA Shoulder Podcast, I don't have a next guest.
I will see you next Sunday.
I literally was like, oh, nice. He's got a lineup.
Yeah.
Who is it?
I guess. No, I have another friend with a pec tear, who I'm going to talk to. He does jiu-jitsu, but I think
Man, it's an epidemic.
he's scared. He's not ready.
Oh, has not had it operated on yet.
Nah. That's why
How
I think
old
he
is
might,
it?
It's within the year.
So it's chronic.
Yeah, but it's like he still trains. He does private security, so he's like he can't like take time off.
Yeah, it's
But
tough.
you just have to, so you just got to figure it out.
Yeah.
I feel like
You
a
should listen to your doctor.
big barrier to surgery is taking time off.
People think they can't take time off, but they can. You just have to do it
If
and
they
then
just ask.
figure it out.
Yeah, I know it's hard.
And then just like try to make arrangements for things, and then just be like, well, this happened, and so now everybody else has to adjust to this
Yeah.
now because I can't lift.
Yeah.
And you just go from there. So take your health seriously. I think that's one thing that took me 2 surgeries to learn. Is just like you have to do that. It's like, no, you can think you are, but it's like, no, actually listen to your doctor, and you really have to let things heal. It takes 3 months. It does take 3 months for things to heal. You can't rush that. Everything makes that help, but like even with bones, they're healed by 2 months, right? But like 3 months,
Depending, but yeah.
yeah, I mean it's like 2 to 3 months before people are like the soft tissue around that has like gotten to a point where it's more stable, the muscles are like healthier, and you can start strengthening. I mean, really, if you just keep that in mind with the, like joint injuries, or like if it takes more than 2 weeks, it might be a real problem. You know that.
Yeah.
It's like it takes, if you can't put weight on it for more than a day, that's a major problem.
Yeah.
But like for your shoulder, sometimes it's like, it just kind of hurts when I do this. So people like avoid that. But if there's bruising, or if you are weak now and you have a change in strength over more than 2 weeks, that's when you should probably go in and get seen. Other than that, I see so many people, it's like, it's been a week. I mean, just give it some time.
Yeah.
Like you don't need to get imaging right away, because like pretty much everything we can fix after 2 weeks.
Yeah.
It's not going to be any different.
Yeah.
So it can wait that long. But if it's 3 months or something, that's too long. So between 2 weeks and 3 months.
Yeah.
You know,
for sure.
and you want to try to get seen as soon as possible, but it doesn't have to be emergent. Unless you're bleeding and dying, then go to the ER. And then we'll get you in.
Exactly. I think the most surprising thing was like how much it bummed me out, the injury. When I was just non-op, and I'm like, something's wrong, but I can't do anything about it right now. The circumstances aren't right. But it like, when you have something that you enjoy doing and then you can't do it anymore, it like definitely will bum you out.
Well, you have to stop doing it because you have to have surgery. Because you're like, it was like me. I was riding motorcycles. I was like, hey, let's go skiing in Mammoth. And then I'm having my surgery. So let me get these things done before my surgery, because it's like, damn, I'm not going to be able to do those things for now at least 3 months, if not 6 months.
Yeah.
You really have to just have that in your head that you're not going to get back to things too fast. So if you're not aware of that, or you're just like, oh my God, I have to do this, it might bum you out. Yeah. So when did you start getting bummed out, when you knew you had to get it fixed and treated?
I think once I knew that I had a surgical problem and I was still trying to find like the time to get it fixed, I was just kind of like, man, I'm 25 years old and I can't do a push-up. Like, it's just kind of.
So you got to the point where you couldn't do a push-up?
Oh yeah.
So like you couldn't rehab it. Did you do physical therapy?
No, I was going to the gym or whatever.
You tried to work out.
Yeah. Stretch it out. But I was doing a lot of band work, but still.
Could you do dumbbells, like dumbbell bench press or anything like that was similar? Or was it that bad that you just couldn't?
No, I mean, it was like 15-pound dumbbell on that side.
Oh, so it was
like
weak.
something's horribly wrong.
Well, when you get to that point, it's pretty obvious, and then it's just a matter of time. You're just like, I just have to make arrangements.
Exactly.
And then you get bummed out.
Exactly.
I can't snowboard.
But that's why I texted you a few times, because in the recovery, because I was just like, when you got your music on and your arms working and all the bells and whistles are working like they're supposed to, and you feel like you're back, it's just like, that's why we all chose to do this job. It's like, it's a really good feeling, and to give that to people is a privilege.
Luckily, you were in your intern year. You hadn't operated too much, right?
Yeah.
Like you don't operate too much. Like you just assist in your intern.
No, yeah, we just do some like basic suturing. We do hand. That's probably do a few distal radius fractures with like very close supervision.
Yeah. You picked a good year to get surgery, my friend. Any other year would have been pretty difficult
for sure,
and would have required some substantial workarounds.
Yeah, it would have required screwing over my co-residents.
Oh, there he is. Hey, Finkel. You're on a double screen.
Hey.
Now we have to re-record the whole podcast.
You screwed it up, Finkel. Now we have to redo it.
Yep.
Used to screwing it up.
I think that's better over here. No, we'll keep it going. Let's just keep it going. Let's see how long it goes. And we're back. All right. Finkel, let's get you on. All right, now we're good. Okay, we were talking about Paymont. So Paymont, we're going to have Paymont on the show.
Yeah, he'd be great.
He'd be great.
He's just a great guy. He's the reason I wanted to come here.
He was a major reason why I wanted to come to Cedars.
I mean, yeah. When I was a med student here, just being around him for the 2 weeks I was around him, I was like, this guy, I've never set foot in California before. I have no family here, but I should be around this guy for some part of my life because it's going to make me better in some way that I don't fully understand yet. And I'm totally seeing that.
He gives you like guidance, you know, like he like watches and tries to give you good advice, I feel.
Oh yeah. I mean, that's like every day. He's like, honestly can't say enough good things about that guy.
He gave a resident his car. Didn't he give Steven Stevens a car?
I mean, he literally would give you the shirt off his back.
Yeah.
You know, just the nicest guy.
Yeah, to make sure like you could get through residency basically.
Yeah, just like he knew how hard it is. He knew, you know, he just cared about you as a person, and you know, knew that nurturing the person would eventually make you, you know, a competent orthopedic surgeon.
Yeah,
that came last.
He wanted me to come to Cedars when I was interviewing, and I wanted to go, but Clapper, I remember that's the guy I remember interviewing with was Clapper the most, and then Paymont, and he wanted me to come. I went to USC, but it just the program was too new at the time.
For residency.
For residency, yeah. And then once the program was more established, I came back, you know, as an attending. But you guys had already gone 5-6 years, I think, by then.
Yeah, it's definitely a scary thing to jump into something brand new, residency-wise at least. You don't know really what's going on.
It's such a great place, though.
Oh, yeah.
I mean, it's like the best residency.
I feel like we got in at the perfect point because now it is like, you know, all these mugs, number one in California, all
Getting
this
in
stuff.
early.
Got in early, and we're reaping the benefits.
Yeah, it's great. I don't really even think of it as too new of a program now. Like we get asked that all the time by applicants. I'm like, honestly, it kind of runs like a well-oiled machine now. You know,
yeah.
And ever since Sai took over too, it's just like, you know, he hit the ground running.
Are they still doing like video interviews, or are they doing in-person interviews? They did those in January.
They
like
did in-person for non-rotators, and then virtual interviews for people who had already spent a month with us to save money, which I think makes sense. Like what, you know, spending money for a hotel and all this stuff to fly back out when you already were there for a month.
How do you pick a program?
How do you pick a program?
Yeah, I mean, it's just kind of.
I think it just ends up being the people.
The people, for sure.
Yeah.
And otherwise, you're going to be unhappy.
That's all it is.
It's the people.
Well, I like, because I was involved in the process this past year, and people always ask, like, what's something I should know going into residency? And like 2 people could go through the same exact residency program and be like light years away from each other as far as their ability. Like, it's the people who are like take personal ownership over like getting to where they want to be. Because, you know, you can go to any program and end up being great or struggle. I think a lot of it's just like personal responsibility.
And your satisfaction with the program, too.
Yeah. And the people, like if you get along with the people and you feel like you have good connections and it's not a total struggle, you know, you're going to end up being happier and do a better job.
It's a definitely resident-centric program, which is nice, you know, because if it's going to be about teaching, you know, you have to have that in your mind that the goal is to teach residents, and you know, the experience has to be, you know, part of it. What's interesting is like working with residents, you see people over the years, and then like sometimes almost everybody's so great, you know, so you just kind of expect like at least things to be like pretty good, and then sometimes it's hard to identify when people are not so great on certain rotations. Even it's just like it's like a lack of like understanding sometimes of just like how to learn that part of surgery. You know, like maybe you haven't done any scopes, and now you just have to like learning the anatomy on the scope is important. But if there's not somebody teaching you that or telling you like focus on this, you know, it's the good learner, good teacher kind of thing. It's like hard to know what the hell to study because you're like reading these books, and you know, all it's going to be on the tests, and like, is Stone going to ask me this? Like, what's he going to be mad about this today? And do I know the anatomy? But then it's like, do I know the case? What's next? Like, there's a lot of like dimensions to understand.
What I think is going to be a huge part of teaching moving forward is virtual reality goggles.
Absolutely.
And essentially, how I see the future going is you're attending doing any sort of bread and butter case recorded somehow on a virtual reality goggle. It doesn't even have to be on a person. It could be on like a VR software.
I'm using those Meta glasses.
Yeah, and then that's uploaded to some like study portal, and then you as the resident can literally watch it and
how I do it,
how you do it,
right.
and how it's being described and what you're looking at, and
POV, man, POV
the entire time. I mean, I think it's going to be huge because you could read about it, you could watch videos, but until you like actually see it and can do the fine movements of it, it just doesn't, it's not conceptually the same at all.
I always got the most out of those types of videos when in training. There was Seth Gamrat at USC. He had 2 videos, one on a total shoulder, one on a reverse total shoulder. It's like, maybe he does it great. Maybe this other guy does it great. Like a lot of people do it great. But when you're a resident and you're just trying to learn how he does it, you just want to learn how he does it. He had a video on it. And I learned how he did it before I even started the rotation. I watched the video like 30 times. Yeah. So when I went on, it was just like, we're going through the case. He was showing me, I'm like, okay, then you're going to do this, it's like, I already knew all that. But like, there's some people that come in, it's just like, they either don't think it's important or they just like can't do it. But most people like eventually can like understand like all the steps. But like I developed the same thing as like the steps to the operation, and you eventually get all those steps. Like if you can make a video and then you do it the same way, like those things should like be basically like in synchrony, because then you can learn in your head how to do it, so that by the time you're actually doing it, you're just learning the motor steps. So I think that's the best way to learn like repetitive surgery that you're going to do like over and over again, like T-lifts or ACDFs. Like you're going to basically do them the same way, and you're going to look out for certain pathology along the way, but like the process of doing it becomes the same. And you can do standardized things same way with trauma. You just standardize it: approach, exposure, reduction, fixation. It's like you just go through the steps, and like whatever they are, you just alter them based on either the anatomy or the problem. But as long as you know the anatomy, like you have to just understand the anatomy, and then the pathology, like the pathologic anatomy, and then the steps to getting it right, like those are like a stepwise fashion that it just, you have to like learn through repetition. But like if you're just going in and you're just showing up and you're looking at a body, like that's a lot. That's a lot to just learn from like watching somebody.
It's
like,
impossible.
It's almost impossible. Like it's impossible when that's ground zero, that you're just looking at the shoulder, to then get to like me doing a surgery. It's like that is what it takes.
Different languages.
Yeah.
Honestly.
So like, but then if you're sitting there and you have all your headphones on and you're watching a video and it's step by step, and it's the key parts of that, it doesn't have to take an hour. And surgery can take 45 minutes to an hour, but the videos are 25 minutes. You just cut them and then you watch them. It's like it ingrains it in your mind of what you're going to see, because I'm seeing the same thing every surgery I'm doing. I'm seeing it in my head. I'm looking at it, but I'm also seeing it in my head. So you just have to learn that. And so like if you want to learn that, like I'll show you that. And if you just watch videos, you'll probably learn that much faster, so that our limited time together, you can gain so much more out of that.
Right.
So like in fellowship, the way I learned was that way. It's just I didn't watch videos because they didn't have any. But like if they don't have videos, I can't learn how that guy does it. Even if I watch how Seth Gamrat does it, I don't know how Jerry Williams does it in my fellowship, so it doesn't help me. So then it's like you have to have specific videos for that surgeon, really, like, or that technique that's pretty similar, because like there's so much variability in a total shoulder or a rotator cuff, or maybe, ACDF is like, it's going to be like implant choice. It's going to be like your, like the decision making is maybe interesting. That's what this show's about, is decision making, but like, and like outcomes and stuff, but like the actual technical part of things, not too much variability with like hardware or plates. It's like you can get fancy, but it's more of like the process for getting that outcome. It's like, selecting the right implants and the right surgery at the right time, and like doing the right rehab, and then avoiding all those complications, but then also trying to maximize outcomes by using grafts or using whatever types of like biologics you need, like maximizing all of that. But then like getting to that point for that one patient that's in front of you and trying to get them there. And you're going to say, hey, just keep trusting me for a year. Like, trust me, you'll get there. Things are going great. But like, so you just like coach them. Like, yeah, things are going well. I've seen it before through my fellowship. It's like I've seen it at least. So I'm doing it like that guy because his outcomes were so good. So like you just keep doing those things that work, and like don't try to like veer off. If you veer off, you might re-injure your shoulder. It's like you just like, there's like, trust the process. There's a process. You guys are gonna have had excellent training. You're gonna have excellent training in fellowship, and like you'll really like hone those things in your fellowship, and then you just write all these things down because you can't remember them, and then your first 2 years are like getting all those things worked out.
Yeah, it's been cool seeing like how your practice has
You guys
changed.
will be great.
'Cause when I was on rotation before, it was way different than when I was on rotation as a 3. I feel like you were a different person, and just the way you went about essentially your clinic and everything was just like, oh wow, you figured it out. It seemed, from an outsider who only spends a handful of weeks with you at a time.
Yeah, you can see a lot of change over time.
Yeah, big time.
With, like how I manage my practice, because it's like you learn things that you're like, oh my god, like you can be super detailed and you can go over everything and be anal about like all of your outcome scores and like your notes, and then you're just like, all this stuff is taking so much time and it takes so much work. And it's great if you're going to do research so you can use it for these things. But like if you're just kind of spinning your wheels and stuff that doesn't necessarily matter for what you're trying to do, you have to start like cutting stuff out and realizing, like for me, it was kind of like, okay, do I want to focus on just like getting through a lot of patients, or do I want to focus on my quality? And it was really like quality. So like I can slow things down and then kind of like focus on like changes that I can make in my practice and in like our whole group, like maybe there's things like studies and stuff that I'm doing that can help other people too. Because a lot of people refer me patients that I refer them patients. It's like there's just a lot of like communication with like patients that need help. So like our goal is trying to get them better. It's like our abilities are like being able to do good surgery. So it's like when I talk to people now, it's kind of like, well, this is what you have, so we both have to agree on your problem, and then this is what I can offer you, and this is what I think will happen. But like you have to tell me that's what you want. And that's pretty much how all the conversations go. Like I don't ever tell people they need surgery. I will highly recommend it. If they have an injury or something that has a timeline, I'll tell them you should schedule your surgery, within 3 months, but I never tell them like you have to do this. They have to make that decision because I don't know their life. I'm just learning them, through a 10, 15, 20 minute interaction. And then it's kind of like, let's make a decision together that involves maybe changing your whole life. So it's very powerful, but also it's like, it's something that you see repeatedly that really helps people. So you just like keep doing those same things that like work, and you should cut those things out that don't work. That's why like being critical is important. It's just like, it could be overwhelming at first when you're just like, you just need to like focus on the big things at first, kind of make sure like, like your like scheduling is going okay. Cause like everything will just start piling up quickly. So just like focus on the quality, focus on like good outcomes or like good communication with people. Because what was happening with me was I was getting burned out, so I was doing all those things with quality, and then as I was getting busier, it was like, to keep all that quality, I don't have like enough help, I don't have enough support staff, and then I get support staff, but now I got to train them, so that's more work, and then you just burn out, and so like something has to give at some point, and it should never be your family, it should never be your own health, because the patients are the people with problems, and they got to listen to this show so they can learn how to get better. But they're the ones with the problem. So like if I can't operate, I can't help so many people now, so it's like I got to get better so I can help more people. So like that's my mentality. So do good work, focus on quality, and like try to help people. Like we should help each other. People should help each other because the machines are going to take over. That's going to screw everything up. So we gotta fight them one day. So we gotta help humans. Yeah. I'm very pro-human. But it's just like I think a lot of that stemmed from my mentality. Literally, as a first-year medical student, I had Shauna Lemmy, who became a facial plastic reconstruction specialist in New York. Super smart, handsome guy, top of the class. Just like had his shit together. And I lived with him as a roommate for a year. He was a second year as a first year, and I was kind of just like, oh, pass, fail, whatever. You're a medical student, don't worry about it, kind of thing. He's like, dude, look it, you guys study. This is important stuff because I don't care if you pass or not, but like, what kind of doctor do you want? You want a doctor that's the top of your class or not the top of your class? And I'm like, I would want somebody smart. And then he was like, well, I'm like, yeah, but it's first year. We'll figure it out. He's like, well, when you get into second year, do you think you're going to have time to learn all those things you didn't learn in first year? Or do you think like this is the time to learn it? I'm like, maybe I should learn all these things right now. So like my first half, I was like pretty average of my first year. And then I just like turned it on because he was right. It was like good first year. You get a good foundation. You worry about now pathology. You can be the best second year, and that's what you just excel because like you just focus like this is important. You have to dedicate time to like learning that craft. It's like in LA, we worry about people being distracted. There's a lot of fun things to do. Like you can like be doing too many other things where like your focus should be learning surgery. Like it has to be. You can do fun things, go kiteboarding, all that stuff, but like your focus has to be learning surgery. It shouldn't be like some people like, trying to get to like Instagram famous or all this stuff. Is like, there's time for that. You got to build that foundation. You can do those things, it's fine, but like it shouldn't take away from like building that foundation. It's like that same thing I learned as a medical student.
I hear you. I think, at this stage of the game, for at least me and you, Lucas, it's just like, you're so like you
guys are too far gone. That is your lost causes.
Yeah, I've been to Erewhon a little too much. No, but it's like you have to build that foundation. You have to build that foundation like strongly and to have all the fundamentals before you can start like doing all the like worrying about everything else about like your public perception and things like. You have to know the anatomy. You have to know like how to indicate people before you can start doing the next thing. Because unless you're confident in that, nothing else really matters. Like your social media presence, or no one's gonna listen to you if you generally like don't know what the hell's going on.
What was crazy, if you ask me, like what was the biggest change between clinic and OR from like training and like practice, is clinic. Clinic has been the biggest beast of a weird like amorphous creature, from like feeling like you're in training and you're just like, I can't wait to be done for the day. Just like getting through this attendings clinic is the worst thing in my life right now.
Can neither confirm nor deny. I've
yeah,
ever had
it's like
those feelings.
at least 40% of the time, and you're just like, I'm not learning anything. You're just, give me the fuck out of here. But like, there's value. Okay, let's find value. But like, there it goes from that clinic experience to like starting like, oh, I'm going to be this nice doctor and I'm going to be so-and-so, so you're putting on this face, you got this like nice clean coat. And then you're just starting to get, just get busy. And then you get so busy, that you're just like, oh my God, I have to do all these work, all these like notes. And it's just like, you start getting overwhelmed. And then you're just like, I hate all of these people. Like all these people are just causing all these problems for me. I have to go to clinic. I hate clinic. I have to deal with these problems. All these people are coming with their problems. And it's this mentality that starts just like burning you down, and it just like will burn you out, and so that's burnout. And you don't know it until you start like yelling at your dog, or like you're just like coming home late, or like you just like you're doing too much work, and so the work in our life is just something that we're always doing. It was like getting to that next level. And so like when you become an attending, you're just like, what is that next level? It always becomes like the next thing. Okay. Become like division chair and chief, all these things. So, you have to understand like what your personal goals are, because there's no ceiling. You can just like literally just do it's just from this point in your life, and then moving on is just pure entrepreneurship of whatever you want to do, because you're going to finish your training and then you're going to get your job, and then everything else is whatever you make out of it. And you can do anything, like literally anything you want really now. Like your parents told you that when you're younger, and it's true, but it takes so much work to get to this point. But like, this is like that pinnacle where you guys have so much ability that it's going to set you off in any trajectory that you want to take it. You have like nothing is written actually right now. So you have all this pure, like, kinetic potential. And it's not kinetic, it's potential. You have like all this stored in, and like, right when you get out of your fellowship, you're just going to be overwhelmed with all these people that are talking to you and trying to like tell you how to like manage things and stuff. So like, you just have to keep your focus, and like all those things that are like those pillars that you've built up to be able to get to that point to then have a successful career. Because like it can just fucking crumble.
I mean, it's cool.
It can just crumble, because then you get the Ferrari, or, you just, there's so many ways that there's traps out there, and so like to be that guy, you just have to know where you want to be, and then you figure out how to get there. And then maybe that's not even the end. Maybe that's just for a while, and then you do something totally different. That's what's cool about our field, is like you get to meet really cool people and like get into their lives and like learn about their problems, and it teaches you a lot about like people, like talking to people teaches you about people. So that's the big thing with me, is like surgery, I've learned about myself. Clinic, I've learned like about a lot of other people, like about a lot more about life, and like how other people, like what other people are into. And that's what got me interested in the podcast. It was like literally talking to people, and it was kind of like how I was looking at talking to people. I started to just really enjoy clinic. I was just like getting into their interest. Like, how can I offer my skill to help this person? All these problems are not mine. They just showed up to my office. But if I'm looking at it in a way that like I have something that I can help this person with, then it helps me, it helps them, and everybody's happy. And it's like, it's really a big mentality thing. And so then if you just like limit yourself, if you want to focus on quality, you just see less patients. If you want to churn patients and you want to still like do what I'm saying and really help a lot of people and just cut through numbers, you can do that too. There's people that do that. They're just, you see 40 patients instead of 30, 25, 30, so you're in total control. Don't ever forget, you guys are in complete control of all of those things.
Mm-hmm.
People will try to tell you different. You will feel different, like you're not in control, but you actually are. So don't forget that. Take time off if you need it, folks.
Was that the biggest adjustment that you made then when you felt like you were getting burned out of clinic? You just dialed it down to the number of patients that you were able to see, and it got back to how it felt before?
Well, I got a PA. The PA helped tremendously, but I had a trainer, and I had a trainer on my care, so that takes time. It takes months. And then to be able to have her actually helping me takes months, where it's offloading me. So really the fastest way to do that is to like realize what the problem is, and then to like back your schedule off a bit, and take random half days off, or have like random days off where you just completely off, like Thursday where you normally work, and then you just put it in 3 months and just take that day off, and then don't schedule anybody that day. And then when you get closer to that day, if you're like, I feel like I can work, or I have this add-on, you put it on, you just work. Or if you're like, oh great, I need a day off, you got it off. Like, these are little things that I never learned. And I've been going for like 5 years, just like, now it's 6 years. And it's like, you got to schedule vacations now. You can't just like, travel, take these trips, you just like, you're teaching, you're doing this, but it's like, you really just need, it sounds cliche, but it's like, it's not just like not thinking about work. For me, I'm always thinking about work, because I'm always doing this stuff. I like it. It's not stressful, but the grind of all of the having to like, answer the calls or this or that, you start delegating a lot more, so like delegating responsibility is like, to my PA has helped a lot, because I can just trust her to manage pretty much all of the issues, because I've trained her well now. And that takes so much off of my plate that I can then focus my attention on planning cases, on then giving high quality conversations to patients, being in a good mood, because I'm not overwhelmed and burnout, so it's like, that's where I will just say, no, like I can only do so much. And then you guys have to just wait to see me. If you want to wait, then I'll do it when I can, but I am only one person that can only do so much. And also, you can only do so many surgeries per year, and like see so many people. So like, hopefully something like this, at least like that part of it where I'm like explaining so much to people, like that can just kind of be learned. It's like watching the videos, like go watch the videos, learn the surgery ahead of time. The videos are there. So, there's a lot more content coming from me. I'm going to be putting a lot more on my YouTube channel. Surgical videos, I will put those up too. But it's, this is the whole process with the LA Shoulder Studios. It's going to be about, like knowledge and education regarding shoulder.
Yeah, I mean, I think it's a great idea.
This is just one of the formats. It's just talking about it, you know?
Yep.
But videos are super, super helpful.
That's the only way I've learned since I've been in college. Nothing else is
the most helpful, right?
Oh,
it's
yeah.
Like,
I can't read. I mean, I can read.
You can't read? This kid can't even read.
Yeah, no, if I'm taking myself seriously and I need to do something, it's video based every time.
Yeah, so what are the kids using these days for like learning? Is there any big changes in that with like video learning or like orthopedic? I know you guys use the what's that called? The Rock?
Yeah, I don't know. If I really have to do something that is meaningful and I need to do it, it's I have to find a video. And usually, I mean, there's some websites. There's this thing called ViewMedi, not associated with the podcast, but essentially it's kind of turned into this.
It's like surgical videos.
Yeah, surgical video-based platform, and it's pretty heterogeneous. There's good and bad, and you have to sift through a lot of stuff, but
you don't know which ones are like.
Yeah, you don't know who's doing it, but I don't know. For example, there's a video on there, like if I have to do a hemi arthroplasty on trauma, I'm like, oh man, I need to watch a video of this real quick. There's some pretty good ones, and then you're like, oh, this is pretty detailed, and you do it.
Super helpful.
Yeah, and you watch it, the week before, or the day before, and you do a ton of them in residency, and you're like, oh, this has actually been great. Who knows how many of these I'll do in real life, because I'm going into spine, but just building the framework to know what you're looking for, and then finding it, and then applying it to like your own hands and brain. That's been the most powerful.
I still watch the Latarjet, the Gilles Walsh, Patty Latarjet video before I do Latarjet procedures. I'll watch it just to look at how he goes through the anatomy and little things I haven't seen before with Walsh. It's just one of the things, you watch that one video and then it's just all in your head. Mm-hmm. So I think, doing that with the glasses will be cool. I think from like your perspective as a resident, what would be the most helpful? Would it be like a general like database of everything where you just go through and you're like, oh, video on this procedure? Or would it be like, well, I don't have everything, but I have the shoulder with Dr. Stone and how he does his, and I'm working with him. So that's what I'm, so like, I don't know how useful these videos that I want to make for you guys, how useful that would be for like the general audience, but it might be.
I think from a resident standpoint, watching you do something before you do it and before you're like expected to, participate in it actively is just it would take a lot of the stress out of it. It would take a lot of like the guesswork out of it. I don't know if like GoPro, hey, reverse, here's how I do it. And then you talk through it and then it's out there, distributed in some fashion. How valuable would that be?
Yeah. I still get texts all the time for, hey, I hear you have a good stone reversed right up, and I've texted it to so many people, but just like watching it in person.
Yeah, you could read, take 2 cobs and find the interval, and then small cob, big cob, blunt home in. But until you do it yourself and you see it done,
for sure,
and then you do it it's just a different ballgame. Now
I'm for sure gonna make a video.
Yeah, like I'm doing.
Yeah. You should.
I'm doing reverses
I
now.
go back.
I think it's useful for patients too, because it's like, hey, if you want to watch what your surgery you're having, you should watch it. Like. And
what did you say to me?
What?
I felt your nerve. I felt your insides.
Yeah, you were like, I felt your. Yeah, we were doing it. And you were like, yeah, you sweep your finger under the conjoint tendon here, and you feel the axillary nerve, and then you turn to me and you were like, I felt your axillary nerve. And I was like, chills up the spine.
This is weird.
I was like, okay, I'm gonna scrub out.
I was inside of you.
Yeah, but it was. I think that stuff would be super useful for patients. Like Dr. Lynn at Cedar, she always talks to patients is like, hey, surgery is very hard. Like this is our job, but it's still very difficult. And I feel like nothing would make a patient appreciate that more, understand that more than literally watching the video of the surgery that they're about to have.
Yeah, and it looks cool.
Yeah, it looks awesome. People love looking at their X-rays.
Yeah, the one thing I was having a problem with was having the lights on, because I can record, but then it looks better with the lights off of the wound. So I just have to do it might take a while to get through it.
Yeah.
But I may have to like talk to the patient and say, hey, your surgery might take twice as long because I'm going to record a bunch of video. Is that okay with you?
Yeah,
sure,
they're going to be like, no,
that's tough.
Definitely not.
It's tough.
Just all about how you.
We're going to sprinkle extra Vanco powder.
That's how you think about it. Yeah. It's a learning case.
I feel like the advancement of education and like just medicine in general comes from like that kind of stuff. Like someone has to, like, there has to be a learning case. There has to be like a, hey, me filming this is going to, rocket launch like every person that comes through my rotations like ability to do this.
Right. Yeah. Right. Yeah.
And then you hit the ground running. And then you can focus more on the details rather than just like, all right, this is
exactly.
Personally,
now let me grab the brown.
Like on the weekends, like I will watch YouTube videos of like how to do a lumbar microdisc, like because there are people that put it out there, and it's like, oh, okay, and like
it's just gonna make you a little better at that.
The details of it. You could read it in a textbook. You could hear a write up, this, that, until you're like under the scope or seeing things and dealing with it with your own hands, and like. It's just a different ball game. So I think that's huge. That's how I learn.
Yeah, I like the videos, but like you can just put them on YouTube,
Totally.
Yeah. They're on YouTube. Most of them are on YouTube.
Yeah. Yeah, ViewMedi, but it's like once you have the content, you just kind of put it out there.
Yeah, no, I think ViewMedi is like just a generic source. I don't even know how updated it is because the videos I watch from there are from like 2004.
I've been making sling videos for patients, like because I get a lot of questions on that. So I'm like showing how to take a sling on and off. And I've been like putting little videos of that so they can just watch me.
Yeah.
So that's one thing I'm doing. It's like I'm just trying to avoid questions. Like, hey, just anything that I'm like, hey, just go watch my video on that. I'm like, just make a video on that.
Well, also it's like how much do people really retain when you're just like in a busy clinic and you go through everything?
You can go refer to it at home. You're like, hang on, let me watch that video.
Or you're in
doing it right now.
Yeah. Or you're in the ER and somebody's mom fell and had a hip fracture and they're just running through their entire lives change. They're thinking about where's my mom going to live now and everything. And meanwhile, it's an IT, you deal with them all the time. You're like, yeah, this is what's going to happen. This is the stuff. But, their whole life has changed. And so if you had, like a video or like a business card that was like, hey, just watch this video, like I'm still going to talk to you about it. I'm not going to not answer your questions, but also watch this video because you're not going to, you're going through something right now. Like
once I leave this room and you're not like, your head's not spinning, maybe this 10-minute
Yeah,
video
like this
will
is
help you digest.
Right, like this is
They did
expectations
that.
and what
They
it looks
did
like.
that. There was a JBJS article actually. I think it was like 6 or 7 years ago.
No, it's on our in-service test.
You know this one?
It's basically just like
They showed him a video.
the
right?
process of like informed consent.
Yeah,
Or
that's
like
what it was.
Some sort of
they
video.
retained it so much more if they
Yeah,
watched a
it's-
little video.
I mean, it makes sense.
Yeah,
It totally made sense.
It makes sense to me.
Yeah.
totally.
I've been to
I
the
think
doctor 100
I think it's a
times.
common sense thing, honestly. That I mean, just having this conversation, I'm like, man, I should do that. You know,
Yeah.
like for X common fractures, just be like, this is what it's gonna look
Dude,
like.
but that's what I'm saying is like, there's not a lot of stuff out there.
Yeah.
And so when I started practice, I was trying to find stuff. Then it's like, it's got somebody's name on it or, you can make modifications, but it's just like pretty much like handouts. There's like, if you just
Right.
read something, it's kind of like, first of all, I don't want to read it. Second of all, like, I'm not going to remember it. Third of all,
You're gonna lose it.
this is way too long and I'm going to lose it. And so I'm just not going to read it.
Yeah.
So then if you have a video, like how to access it too. That's the other thing is like, I have so much stuff. I'm like, where did I leave that on my computer?
Yeah.
How do I access that? So I've just been using notes. I
Yeah.
pretty much use notes and I put links in my notes and I just have like these folders, like
Yeah.
all my podcast stuff or like work stuff, but that's been helping me just stay a little more organized. But with like YouTube stuff, you just like follow them, just like
Yeah.
my channel, subscribe on YouTube, LA Shoulder Podcast. But you can just like subscribe and then like every time there's new stuff coming out, it like comes right into your feed. So it helps you
Yeah,
stay organized,
exactly.
I guess.
I mean, at Cedars, they have the arthroplasty stuff completely streamlined, and they have.
What are they doing for that?
I mean, they have the pamphlets, they have the classes that people go to.
Teaching classes, they go in person.
Yeah,
right?
or they're virtual or whatever, where it's like, this is what to expect from your total hip replacement. I feel like if you just do that, and probably this stuff exists.
And like people are there, they're like raising their hand. They're like, when can I have sex? When can I sleep on
Yeah,
my
or
side?
when can I drive? And all this stuff that's like, they're the same questions that get asked by different people, but they're important questions to ask.
And everybody wants to know.
And easy to forget too.
Yeah. Watch a video.
Exactly.
I mean, yeah. Like
This podcast brought to you by Videos. Get them at your local video store.
Yeah.
They don't have those anymore.
Blockbuster.
It's all online. Do you know what Blockbuster is?
Oh yeah.
Of course, man.
99 cent video
every
store.
Friday night of elementary school.
Not that young.
Blockbuster was like $5 videos. You're like, I don't want to rent it for 5 days. $6 is too much. I just wanted 99 cents for one night. And
Yeah.
I'm gonna send it home tomorrow after I rewind it.
One video game, one DVD.
Every time.
Yep.
Yeah, DVDs just, I remember when they came out. That's how old I am. I'm so old. But it's all pretty much the
So
same
old.
now. It's like once DVDs came out, it was like, okay, guys, it's digital now. So
Yeah.
you guys got to figure out these formatting things.
I mean, yeah. There's a technical.
Nobody actually told us that CDs were pretty much the same as like MP3s, and it's just like a format.
No,
It's like,
you just get-
that's way too complex. We
you-
can't understand these things.
You get fed information. You're like, okay.
Do you think there was any person that ever understood how record players worked that were like normal people?
No.
No, exactly.
mean,
I
Like,
think about that all the time.
dude,
Like, how many people can explain?
how is it on there? How is the
stuff,
music on
like
there?
how many people can explain how that light works?
Dude, none. How many people can
Not
explain how
none
a
is the answer. Some can.
Some. How a Bovie works.
No.
Electrocautery?
Yeah. I mean,
Dr. Bovie?
I looked this up
I don't know.
pretty recently because I was like,
I call it a hot stick.
I should know how this works.
Please enlighten us.
It's basically like different.
Frequency,
It's
right?
differential.
Electric
Yeah, it's
frequencies.
differential currents, and
Yeah.
like that's what cut and coag are. It's
This is where we start blinking the misinformation on the screen. Warning. Misinformation.
No, but it's like those little things that you don't really look into, and you're like, I should probably.
I
know that
always
this
use a
works.
protected tip now. I just always use a protected tip.
Some people in spine will use like, it's like
It's a spine thing.
well, it's a needle tip. It's
Yeah,
it's like
I don't like that. I stabbed myself before.
it's hard. You
It's
could
very painful.
you could really actually mess something up if you use that. If you're not
It's
good at it.
dangerous,
Yeah.
but it's also very precise.
Yeah, you have to like, you can't just pick one up and be like, oh,
It's a
I'm gonna use
baller
it
move.
today. It is. I used it once and it was like, oh, I need to.
It's too much for me.
Mm.
Yeah, I need something like less killy.
Yeah,
It's kind of killy.
it
Especially
feels
when
like you have a
when the
lightsaber.
the
Something a little
residents
bit more
grab it.
gentle.
The residents grab it. They're like,
Yeah,
I got this. I got this.
No, it's not a resonant tool.
yeah.
It gets real stabby. I got
You would
stabbed
never
when
let
I was a
us use that.
fellow in my finger with a hot needle bovie through my glove and just like stabbed the hole to my
I hear
bone.
those hurt really bad and take
It
a while to
hurt
heal.
for like a month.
Yeah.
It
Wait,
just
but
it
people,
was
like-
healed and it still hurt.
People Bobby over their finger all the time. It just was on your finger for too long.
It was so sharp it stabbed into my body
Because right.
because of the
I've-
freaking needle, not because of a normal bovie.
Oh, just because it was the actual.
Hot, yeah, it was
Ugh,
not good. It was hot lavender, latex inside of my body. It was not good. It was bad. It was just burned.
Sounds like
inside.
it would hurt for at least
It
a month.
did. It took a while to express itself out.
Ugh.
but it's healed now. I don't know. I've been stuck and injured so many times, but you just kind of clean it and wash it and move on with your life. I don't know.
Yeah.
As long as it's not like something like hollow, I feel like, or like you just get like, well, that went from there into here, and that's not good.
People have talked about that for aspirating total joints. Like, some people say you should use a spinal needle because, you know, if you just stick an 18 gauge, it has that tiny core, and theoretically sticking just an 18 gauge needle into the knee, you're taking that tiny microscopic, basically skin biopsy.
I wouldn't
just
do that.
putting it into
No,
their
you should use
joint.
the stylet.
Yeah.
Yeah, when you put it in, and then you take the stylet out.
Yeah.
Absolutely.
Hmm.
Yeah, the stylet prevents that. You don't want to do a hollow,
Yeah.
like a core, because it's like a core biopsy.
Yeah, exactly.
Yeah, there's been crazy things done at LA County.
I think it's done kind of commonly everywhere.
Yeah, well, it happens. It's just training. You know, it's not any particular hospital. It just happens in life. And sometimes even experienced surgeons do crazy things that are just, you know, sometimes things just do okay, and sometimes things get messed up, and you got to fix them. So it's just what happens. But I think what really, like, what got me into, like, the mode of, like, all right, so what do I need to do to, like, start figuring out what kind of things I need? It's like, you just like go. You show up to your job, and then they kind of ask you, like, you worry about these things. You're like, oh, I got to have all my instruments. I got to have my cards, all these things. Like, no, you just have to, like, know what you need. Like, when you see it, you're like, show me what you have. Okay, let me see your shoulder tray or your general tray. And then you're like, half of these are terrible. This half is good. And then you're just like, it's missing. I know it's missing these things. And then you just order them, you know? So there's ways around, like, what you know you need for your cases. And then you just kind of, like, you know, in your head, like, well, during training, you're going to do certain cases and you're not going to do other cases in reality, like when you're an actual doctor, you know, treating people. Because, like, you have to, like, tell the patient and their family, like, I don't promise you're going to be okay, but I'm going to do my best. And I really believe I'll do a good job, you know? So, like, if you're doing something that you can't say that, like, you should realize that probably by now, like, in your training, because you're not going to get better at pretty much anything other than, like, from your fellowship, you know, and the rest of this year. So, like, you just don't have that much more time realistically.
I know.
You know, and maybe there's a few.
We were talking about it on the way up here.
Well, maybe there's like a few. It's like, and not. It's like the reality. Maybe people don't know, but, like, the reality of training is there's not one perfect program. There's not one program that does all the surgeries. You know, it's just surgery is just so complex that it can be so variable, and it can be, you know, something that's like heavy reconstructive, or like they end up doing a lot of spine surgery, or like very little spine surgery, or a lot of traumatic spine surgery, but maybe the trauma people take all the hand, so that you do no hand, but you do all the trauma on the spine. So it's just how things go. But there's still great programs that are very, very well known across the country, and, like, ours is one that fortunately is, like, great all around. You know, it's like everything is pretty covered in terms of, like, training. But, like, you're still not going to train everything, and you're not going to train everything all the time. So you're not going to be a specialist at, and, like, maybe some things you'll be pretty good at by the time you're done in residency training. But, like, then you know, like, okay, what I can do, what I'm going to learn, and then, like, what I pretty much shouldn't do. You know, and so, like, and then maybe there's, like, a few things at the end of your year you're like, I just got to do a few more of these if they come up, you know, and then that way you'll feel competent. You know, but you should start thinking about those things now.
Yeah.
That's what I'm doing right now. I'm on arthroplasty now, and I'm just like, you know, the opportunity is potentially there to do elective arthroplasty and revision arthroplasty and stuff. And so I'm just trying to get as many reps as possible, which I should still get those reps in fellowship, but just in case.
And go to clinic too. Go to clinic.
Yeah, I have been too.
Especially with the people. Don't do just. I would say, like, one thing that helped me probably the most in fellowship was just being with one guy who I really respected.
Yeah.
How he thought and how he solved problems in clinic, Jerry Williams, and I just, like, lashed onto him. You know, I just, like, got in his head of, like, how he, until I could, like, figure out how his method was. You know, so if you can do that now for some people of like arthroplasty as much as you can, like Spitzer or like Pennenberg or like anybody who will have you, you know, if they'll have you around, like, you can, like, just, like, how they're handling those problems, even if you're not doing much, you'll be like, oh, I'm glad I, like, hung out that day.
No, it's been great. I mean, they've totally.
But you got to be there. If you're not there, you don't have that memory. You don't have that.
No, I mean,
learning.
I'm literally, they've been awesome. I'm getting their preference cards. I'm getting their case requests. Like, basically, they're like, this is what you need, you know, and this is how I do it.
You should yell at the juniors too.
Lucas does.
Good.
No,
definitely do that.
I'm very nice.
Somebody needs to.
I'm nice.
That's fine. Who's mean though? Is anybody mean? There should be. Somebody should be mean.
No.
He's the meanest.
We're like good.
I'm not mean.
Me and Lucas are good
You're
cop,
nice.
bad cop, but we're both good and bad.
You're kind of like the disappointed uncle. You're just kind of like and they're just like.
I'm not like, oh, I'm mad at you. I'm like, hey, this is how I messed up. So, try not to do
you've
this.
messed everything up.
Literally.
So you're like, hey, let me show you
Like,
how I screwed that up.
literally, that's what I did.
That's why you're so great.
Well, yeah. Like,
That's
hey,
how I
man, I
was
did
too.
it this way. It didn't work. You should probably not do it this way.
Yeah, you're probably the best ever, Lucas. I think you're the best ever.
I agree.
It's definitely false.
I think you're the best.
Definitely not.
There's been others who have been great, but you're here, and so you're the best.
yeah,
You're
exactly.
the best ever.
Yeah, exactly.
Finkel's
I'm here.
great too.
Next week's
he's a
guest will be
strong
the
argument.
best ever. It'll just be whoever's on.
Next week we'll see who shows up.
Christy Blau.
Best ever.
Christy would be great to have on because he had a neck injury, right?
Yeah, and he's an Ohio State Hall of Fame volleyball
But
player.
he's so quiet. He'd just be like, he wouldn't talk.
No, he would talk.
He wouldn't talk at all.
He would get, you just got to get him talking about
say,
them.
Say something.
He's going into sports.
We'll call him on the
No,
way
I'm gonna
out
have.
here.
Of course, I'm gonna have Christy.
You
on.
should
He'd
definitely
be
have
awesome.
Christy on. He'd be great. Yeah.
I love Christy. Christy is actually the best, but you don't
Yeah.
gotta say it because he knows. Everybody
Yeah.
knows he's the best.
But he's extremely humble about it too.
He's very
he
humble about
legit
it.
gets mad at us for like telling people about the Ohio State Hall of Fame thing. We're like, dude, that is
coolest thing
news
ever.
that deserves to be spread.
He just he's so interesting. He's a very interesting guy.
Yeah.
I like him a lot.
Yeah.
But even in surgery, sometimes I'm just listening to him. I'm like, should I be listening to him or should I be telling him? I'm not sure. I'm
Yeah,
gonna listen to him.
I know.
God damn it, Christy! Now it's fucked up. He's just like, well, I don't know. I'm learning.
I mean,
It's
I
like,
don't know,
well, fuck
man.
it.
Yeah.
No, but that's interesting too. It's like I can always learn from these guys, like you guys.
Yeah.
It's like no matter how good you are, it's like I sometimes will let you do too much, and then I'm like I should not be letting him do that much because it's something that I just need to know that he knows what he's doing ahead of time. You know, so sometimes it's like you kind of get into things and you're just like, oh yeah, I kind of know. It's like you just got to be right there. That's why I'm always right there.
Yeah.
But with somebody like him, he's basically almost a surgeon himself.
Mhm.
So are you. You can do. You know what you can do. You guys can do cases. You can do cases. You guys are great. But it's because of how shitty you were, as an intern and as a junior resident and just you especially, it's just I was just I like you, but we can't be cool because you got to learn surgery, and when you came back, it was dude, you were one of the best from what you were as a third year to a fifth year, no, by far, you were such a great fifth year. And as a third year, it's you were still figuring it out, but that's why it's so important. Cause then you get there and then you're just oh, okay. If you just kind of just I'm not going to listen to that guy, it's well, I'm literally trying to teach you. So you'll be better because of it. And there's just so many people like that. Most people really just want you to get better there. So
yeah,
it's a good place.
It's been great. I honestly, it's been the best. It's been the best 5 years ever. I couldn't imagine it anywhere else.
Well, hopefully you can come back.
We'll see.
Yeah, we'll see. I'll talk to Paymont.
He's an East Coast guy.
So where did you guys how did you decide to come to LA for training? Why did you come?
I mean, honestly,
that program?
when I was
But why LA? I mean, Cedars is great, but why did you come to LA?
I mean, when I did a sub-I here because I lived with a guy in college who was an ortho resident, or actually he's a fellow now, sports fellow at Pittsburgh, and he told me about Cedars, and he was like, "You should check it out." Never set a foot in California before I went. My first sub-I didn't really know anything about anything, especially what I was looking for, and like I was mentioning, I met Paymont. I was like, this guy's. It gets better than this guy, and then
I knew Moon. Moon was my guy.
Yeah,
that's how I got.
I mean, truthfully,
cool as shit.
all the guys, the residents, I couldn't imagine being at a place that was better than there. And then I did my other sub-Is; they were great, but I was always sort of just attracted, drawn subconsciously back to here, and luckily, it worked out. But
yeah, then COVID happened and everything got screwed up.
Yeah, pretty much. But I mean,
you're like, man, why am I in LA? I can't do
it would have been
anything.
better. But yeah,
Finally, just this year we can do stuff now.
That's how it happened, though, and it was. It was awesome. And don't regret it at all.
Where's home?
New Jersey.
So you might go back.
I'll probably go back.
You can probably go back.
Yeah.
New
but
Jersey,
we'll
you can make a good life out there.
I think so.
You should run a podcast anywhere.
You could.
Yeah.
I don't like saying no to anything anymore, honestly. I kind of just keep all doors open all the time.
Yeah?
And
You like open doors? You like to keep your doors wide open?
I like to
Don't say no to anything.
Nothing.
Anything.
Nothing, right?
within reason. I mean, I just think, it's you're just too young to just flat out tell somebody I'm not interested in that, or I don't want to take that job opportunity, or I'm not interested in living in that place, because you don't know. I didn't know I was going to live in LA. Well, I'm a New Jersey boy. never set foot out here, and now I couldn't imagine not living here.
So I'm going to ask you both this question. So take away orthopedic surgery. Now you're in your practice. You're a competent spine surgeon. Let's say you've achieved all of these goals. So what's next for Ryan Finkel outside of surgery? Let's say you've hit those surgical goals of your career. What other any other things, like, you know, family? Is it you know, is it political?
I mean, I just
more
had
personal goals. You
just
wanna
had a
achieve?
kid, so
Or just hanging out, getting fat, enjoying life.
after having
Bigger pool.
After having my first kid, I cannot imagine like that not being the most important thing to me, no matter where I was or what I was doing. So I would say, you know, competent spine surgeon, safe, good, obviously super important, but family man, and basically being like a good husband. Probably number
So
two.
family stuff.
Yeah, I would say family stuff.
So getting fat, basically.
Yeah. Even though
Lucas?
getting fat would be tough. I have never been fat.
You gonna keep working out?
Always.
Yeah.
Yeah.
Once your nerve thing goes away,
Oh, it's back. I'm already benching again.
you good?
I just put up. Yeah,
You looking thick?
I'm looking. Oh, it's the creatine.
It's a.
It's a great team. He's retaining all that
You're
water weight.
juicing?
Yeah.
Yeah, you got that water weight on.
I'm at. This is like the most athletically dialed I've been since college.
You
right
look
now.
good. You should do modeling now, before.
Don't say no to anything, right?
We got the studio here, LA Shoulder Studios. We can
Put you
use
to the test right now.
Yeah, we can do it.
All right.
I'm gonna need some sling models. So what's next for Lucas?
I mean, ditto, honestly. I have a young son, family. I haven't lived in the same state as my brother since I was 18 years old. So my focus is just on being very good at my job, taking great care of patients, and whenever I can, spending as much time as I can with my family, taking advantage of all of my brother's hobbies so that I can get a few of my own, all the hunting and fishing and everything.
Fishing, hunting. I do both. I fish, I hunt, I kill.
Yeah.
Pretty much those.
All that stuff. But I mean, as far as the orthopedic stuff, I think trauma's cool because it's all surgery is like application of very similar principles. But I always kind of envision myself like teaching at AO Basic or this kind of thing. Like even if I'm not
It's like
explicitly
education.
teaching residents, I really get fired up about stuff at like AO Basic and whatnot. Like I thought it was an awesome experience. The guy who runs the orthopedic trauma Instagram was my AO Basic
Who was that?
teacher, Githens, Mike Githens at Harborview.
Hour.
Yeah, we were in the same table, dude. Sorry. But yeah, I mean, literally, remember we were always like the last to finish at our table. We were like, dang, we stink.
Just messing around with everything.
No, but he was like, we would get like the general instruction, and then he would be like, all right, guys, before we start messing with the sawbones and whatever, like, let me just take a few seconds to like explain the principles of how like a DHS works. And it was awesome. And to do that for somebody else, like to pay that forward, I want to do that. So even if it's not explicitly working with, I would love to work with residents, but if I end up in Idaho, like the plan is, there's not a whole lot of medical education infrastructure out there. I would love to
Perfect.
like, if it got started,
Perfect. Make
No.
videos.
I
Brought
mean, if
to you
it-
by videos.
literally, if it got started out there, I would love to get involved. But for now, the AO Basic stuff, the OTA stuff, I would love to be involved in.
That's cool, man. Like educate. I met Moon at AO course.
Yeah.
Yeah, and it was like, hey, you were a county, and I was a county, and that's how I got a job at Cedars. So far, well, dude, it's been so awesome having you guys. I think telling your stories hopefully been helpful for some people, and this has been the first episode. So this will be forecast for eternity on
Love
the LA
it.
Shoulder podcast. Thanks, guys.
The inaugural
History.
episode.
Yeah.
Thanks for having us,
Yeah,
Jim. Thanks for
appreciate it.
fixing my pec.
Yeah, man, you're
I
welcome.
really appreciate
Cheers,
it.
guys.
Thanks for being a great teacher.
We're building it.